Good afternoon. I'm Veronica Adamson. I'm part of the doctoral program here at Harvard T.H. Chan School of Public Health and the founder of InnovaHer, a think tank unlocking stalled innovations through system-level strategies, starting with maternal and infant health. I'm the moderator of today's discussion on America's declining birth rate. I'm honored to be joined by our esteemed panel of Harvard Chan faculty: Anna Langer, Professor of Practice of Public Health Emerita; Maggie Ann McConnell, Associate Professor in the Department of Global Health and Population; and Henning Tiemeier, Sumner, and Esther Feldberg, Professor of Maternal and Child Health. Thank you all for being here today. The fertility rate in the US has been declining for years. According to CDC data, the birth rate has reached a historic low of 1.6 in 2024, meaning the average woman is having less than 2 children. Compare that to the 1960s when fertility rates were around 3.5. Let's begin by looking at what's driving America's falling birth rate. I'd love to hear from each of you, but Anna, let's begin with you.
Thank you, Veronica. Thank you so much. And thank you for organizing this wonderful panel on such an important topic. We've known for decades that reproductive decisions and family size expectations, and at an aggregate level, at a societal and regional, national and regional levels, those decisions are the result of a complex network of factors. The evidence was initially collected from programs that try to help women and couples and families to limit the number of children, to avoid unwanted pregnancies. I mean, contraceptive family planning programs and more comprehensive sexual and reproductive health programs. And more recently from countries that have been trying to incentivize births because they are concerned, as the US is now, about the decline in fertility rates in their context. So based on surveys and research projects and other sources of information, we now know that demographic factors at the individual and societal level, socioeconomic factors, educational levels, gender, and culture, including religion, the policy environment, the women's participation in the labor market, access and quality of healthcare, and concerns about the situation in particular countries or regions or the world, all intervene to define the family size desires and fertility rates. But what are the leading factors now in the US that are influencing the declining birth rates that you mentioned? Multiple surveys shed some light on that, and they all come up with similar results. And the main concerns that people have are a lack of affordability. In other words, that basics like food and housing cost too much to afford having children. Bad experiences with difficult pregnancies and deliveries. So we will talk about that later, I guess. So that's definitely something that is influencing people's decisions to have or not have children. And the wariness about the state of the world are the major concerns. When the people talk about wariness about the situation of the world, they basically mean climate change. And they are still thinking that in many cases that the population of the world is too big to be supported by the resources that we currently have. The people who decide that they don't want to have children or say that they don't want to have children, basically it's because that's their decision, because a childless culture is growing to some extent, and or child-free culture is growing, and people are now deciding in many cases that instead of having children and having a family, they would rather focus on their jobs and or on their careers and on other areas of their lives that they consider more important at that point, at least, than to have children. And when people are asked about their concerns about low fertility rates, they are usually not even aware of that as a problem. They are more concerned about overpopulation or high population growth than they are about low fertility rates. So that's in very, very basic terms what's behind the low fertility rates that you mentioned.
Thank you, Anna. That's fascinating insights on affordability in the state of the world. Maggie, I'm curious what thoughts you have on this topic.
Thank you. Yeah, I'm happy to be here to speak about this very timely subject. So I think one of the important facts to consider when you think about the declining birth rate is, the population where the birth rate has been declining most rapidly is actually women 15 to 20 years old. So almost, a huge chunk of the declines when you look at the fertility rate numbers that are often cited, which fertility rate has been going down sort of every year essentially since 2007. So there are natural fluctuations in fertility rate over time. It's not always going down. Sometimes it goes up, sometimes it goes down. It has been going down since 2007, but it really is concentrated among 15 to 20-year-olds. And you can think about that as, some of those pregnancies may have been unintended or may have lacked access to sort of, convenient and effective contraceptive methods. So there's some element of changes in the fertility rate that have to do with that. In general, people are also having children much later in life, which is related to sort of huge changes in, the sort of demographics and education profiles in the U.S. So, people, many more people going to college, and that is also related to having babies later in life. There's also sort of the data is a bit sort of contradictory in a way because the fertility rate is steadily going down. But if you look at numbers that are more sort of give you a sense of how many babies women have over their lifetime, those aren't changing as radically. So if you look at, women between 40 and 44, exactly my age, the number of children they've ever had in their lifetime is actually not changing as much over time as the fertility rate. So, I think there's sort of some nuance behind some of the fertility rate numbers, and a big portion of this does have to do with really big changes in that younger age group. That said, this is a trend that's happening all over the world. So, many, not every country, but many countries and many different cultural settings and many places are seeing large changes in people's decisions about whether to have children. And so I think we need to sort of take them seriously and listen to them and think about what they mean about what kinds of societies we're building.
Yeah, that's fascinating. I mean, you're mentioning the sort of the global perspective. New research from the United Nations found that the number of children born to the average woman worldwide has reached the lowest point ever recorded. And I'm curious to get your thoughts, Maggie and then Henning, on whether that's concerning and what are the impacts of a decreasing population.
I'll just jump in and then I'll let Henning speak. I'm not, terribly sort of concerned. I think anytime we see people being able to make fertility choices that best suit their family, I think that's a success. I think people choosing to have children later in life, also a success. I think there is the other interesting fact I would say is that many, in the US and other places, people don't always reach their fertility goals, right? Sometimes people would like to have 2 children and they end up with 1. So to the extent that we can make it possible, for people to reach whatever their desired family size is, I think that would be the sort of societal priority.
Henning?
Yes, thank you for inviting me for this wonderful discussion, or great topic at least. I'm not sure what the question is asked now. Shall I add to a general view on declining fertility rates and the causes? I think much of it has been mentioned. The one thing I would like to add is that the relationships between men and women have changed. Partnering has changed in many ways. And some people, there's many ways to attribute it, but it also is tied in with economic factors too. So it's the societal, the sociological changes in these relationships, but also the economic changes that women are more independent and thus don't, for example, depend on a male partner to sustain a reasonable standard of living. That's another thing that hasn't been mentioned. So there are more choices. I think we've mentioned contraceptives. That was, I think, the first thing Anna mentioned, but that's, of course, in a way, the biggest driver of these global trends. And if you now come to the global trends and say, is it a worrying thing. I think that's just a too simple question. It really depends on the country and the extent. So there are countries in Asia that have a fertility rate below 1.0. I do think we would agree that that is worrisome, and what that means for immigration goals and things is certainly a big discussion. If you think there's countries that come from 3 to, or even 3.5 to down to 2.5, you think that's perhaps not worrisome. It often goes together with increasing economic growth and welfare. And if you think about the US, there are people that are very worried, others less so. You could argue what is a good fertility rate, and you could argue Maggie's number that she mentioned, how many children a woman with 45 had in her lifetime is perhaps more relevant. I think we could probably agree that any decline that is too fast will give major problems societal and economically, just simply because there is too few people in the workforce to keep up an elderly population is one. And if you're down below 1.5, I think there's real major societal changes. There's few children around that are worrisome. So I think there is a reason to think, is this a sign of the US fertility rates going down further? And when should we, see that as a public health or economic problem? That's something.
Fascinating. Thank you, Henning. So it sounds like a question we should be asking, but no simple answer. So Maggie mentioned earlier that teen pregnancy rates have also been declining with a new record low in 2024. So from 2000 to 2024, the rate of births among ages 15 to 17 declined by 8%. What's behind the trend, and do you expect it to reverse with states restricting access to contraception, which we've talked about a little bit, and removing evidence-based sexual education? Henning, let's start with you.
Oh, I was going to rely on the other answers of others. Okay. So the first thing I want to point out that it's indeed there where the relative decline is the most. To point out that relative because it's not that women with 15 and 16 where the big, part of reproduction had that many children. It's just that we see the dramatic change. And we see that to the availability of contraceptives, but also to much more sex education that comes via schools and probably also a lot via internet and peers. It's much more openly discussed. The use of contraceptives is earlier. Also the change in societal goals, the pressure on higher education, and sort of the education that's beneficial to achieve welfare. So that's the big change there. And I think by and large, most of us would see that as a big societal success. And note that many of these women get children later. So it's not that women who got their children at age 18 in the past now never get children. It may mean that they get it with 25 after they've finished education. And that's certainly often a good sign.
Thank you, Henning. Maggie, anything that you want to add on this topic?
I think these are all sort of, I think access to contraception is a really significant one. I think there's a lot of changes in sort of education profiles and, where people live and the sort of lifestyles that they're, graduating into, and sort of young people coming into sort of urban centers where, you end up having people delaying fertility until later. In terms of the question about whether this is likely to reverse, I think that's an incredibly important research question, and one that I think many people are working on. I think the early evidence from, the impact of sort of more restrictive contraception and abortion laws is that we'd expect more vulnerable populations to be more affected, and that might include teenagers.
Interesting. And I know that you've spent some time thinking about this topic. Anything that you'd like to add before we switch gears?
Yeah, maybe a few words about sex education that has been mentioned by Maggie and Henning before. Sex education has been studied for many, many years. And in fact, we know that when adolescents and young women and men get a comprehensive sex education, they are less likely to report a pregnancy or to become pregnant. So sex education, when it's good quality sex education and offered in the right setting and linked to contraception, because sex education alone wouldn't make the change, but coupled with quality contraceptive services, definitely works. The US is a patchwork of sex education programs because there's no federal mandate. They are decided at the state level. So in some states, there is almost no sex education or abstinence only programs. And we know already that either of those two work, they don't work. While in other states that have comprehensive sex education programs, they are quite effective in helping adolescents make the best decisions for themselves. Henning mentioned quickly that teen pregnancy is a risk. I mean, girls that get pregnant at an early age face themselves and their babies important health risks, preeclampsia, preterm birth, higher maternal mortality, and they also face social challenges. Usually they get a lower level of education, they are not properly inserted in the labor market, they face stigma. So it's a big issue. And as Maggie mentioned before, helping adolescents prevent an unwanted pregnancy is definitely a success. So this is an area that we should focus on.
Thank you, Anna. That's fascinating. So switching gears, the Trump administration is exploring incentives to encourage Americans to have more babies. And a recent Associated Press poll suggests that addressing foundational factors to birth rates may be the most impactful. The poll showed that about half of Americans want the government to prioritize improving maternal health outcomes and childcare affordability, while about 12% want the government to focus on encouraging more births directly as a top priority. The Department of Labor reports that the average American family spends up to 16% of their income on daycare for one child. Is it possible for states or federal government to make childcare more accessible and affordable? Maggie, let's start with you.
Thanks. Thanks for this point. You know, I want to sort of start by saying I think the evidence on sort of paying people to have children is actually quite weak. Many countries have tried this and have failed, you know, even when they've put substantial resources into it. I think we see, you know, as I mentioned before, we see very similar trends of declining fertility, even in countries that have an incredibly generous safety net. So the dynamics here are quite complex, and I'm not sure we have, even if we thought that declining birth rates were a real, you know, economic catastrophe, I'm not sure we have a very good intervention that would reverse this trend, aside from immigration, which I think is quite effective if you want to have more people in your country. So, you know, I think the, you know, to the rest of the question, can we make sort of parenting more affordable? I certainly think, yes. I think if you look, the US has uniquely challenging conditions for parenthood when you compare it to other high-income countries in terms of sort of general affordability and sort of infrastructure and support for children under 5, which in, you know, many places is non-existent. And there are many cities and states that are innovating a lot around preschool, pre-kindergarten, you know, things that are going to move the needle a little bit, but you know, there's sort of a very long way to go on sort of making childcare more affordable. I think the interesting thing is that, you know, affordability is a big issue, but I don't think parents are a very large kind of juggernaut politically in the US. The sort of political juggernaut in the US in terms of dictating where spending goes, you know, we put a huge amount of, you know, the sort of dollar to dollar, if you think about investments in infants versus people over 65, is way skewed towards over 65, and sort of investments in early life in the US has not been, you know, politically sort of a huge driving force. I think that there would be, if we think about even policies around free college, in some ways there's been more political will behind those policies compared to thinking about the affordability of childcare. And so that is something that you know, that we certainly could do, but I think there isn't, you know, one sort of thing to grapple with is how do you drive that agenda forward of making childcare more expensive, because it is a huge investment, and it requires a lot of resources. But I think the other way to think about making early childhood more affordable, most families go through, most families experience the birth of their child as an economic catastrophe. I mean, their sort of income, sort of plummets. The likelihood of entering into poverty is the highest, in the sort of first years of your child's life, because almost every family makes less money, either because they're working less, or there's something unexpected that happens, so their income is not the same as it was before. So, and some of that is replaced by the U.S. social spending programs, but they're not nearly generous enough to get people to sort of the baseline that they would have been at before they had a child. And so we tend to sort of, as a country, we tend to be much more willing to invest in healthcare, top of the line medical treatments, even compared to kind of basic income, food, and other supports. But I think we should do those for a variety of reasons. I could name 10, but the improving the birth rate is not in my top 10.
It's an interesting paradox, right? It's an economic catastrophe, but simply putting money forward doesn't necessarily solve it either. And you gave some really interesting ideas of, how we could approach it in a more nuanced way. And I'm curious to get your perspective on this as well.
Yeah, I would like to build on Maggie's last comment. I mean, helping families raise their children in a way that they are healthy and happy and the whole family is doing well is a human right. I mean, it shouldn't be something seen as an investment to make the population grow. Maybe, unlikely, but maybe that would help achieve that goal too. But as Maggie mentioned before, it has been tried in many places, and not only to make the population grow, but exactly because they think that that's what the society, the people in that country deserve. And it hasn't worked much to increase the fertility rates. We should definitely encourage in any way we can those things to happen. But again, the goals, at least from my perspective, wouldn't be increase the fertility rate. I would also like to point out that although the goal has been mentioned in different occasions by different people during the current administration, I don't see too many changes happening. Maybe it's early, and we will see them, but so far, I don't think that that goal has been translated into concrete policies and budgets and actions. What else? My colleagues mentioned some people who are particularly vulnerable. And yes, of course, whatever resources become available and whatever policies are put in place, from my perspective, should target those populations. And basically, they are people living in maternal health deserts that I think we will talk about later, adolescents that we briefly mentioned before, Black women, poor women, and poor families in general. So definitely those should be the priority. But the entire population, regardless of their socioeconomic and educational level, should have access to universal health care and to the benefits of that we discussed before.
Thanks, Anna. Henning, anything you'd like to add on this topic?
Well, I think Maggie said it nicely. The evidence is weak, and what she means is there's weak evidence or there's good evidence that it has a weak effect, these economic incentives. We see that from France and Hungary, who have tiny bit higher fertility rates with massive programs. So we must realize that, a $1,000 or $5,000 birth gift won't change the needle at all. You have to think of 50,000 to make it work, and higher. And at the same time, I think this is a very interesting bipartisan topic, because there was an incentive from the Biden administration to support childcare more. It was taken out of their bill in the end. And now we see on the other side of the aisle incentive to raise the fertility rates. And I think we should come together and see what can we do in childcare and taxing to make the lives of families easier. And even if it doesn't have a huge effect on fertility rates, first of all, a small effect would be quite welcome. Secondly, that it's sort of, as Anna also points out, it's a goal in its own right to make the lives of families better, to have access to reasonable childcare, to have perhaps more maternity leave, or even think of options for paternity leaves, or how we could incentivize that. I think that's important. The other debate I'd like to refuse to have is how that relates to incentives to improve maternal health and outcomes, birth outcomes. I think that's not at all something that you can relate. If anything, you can relate the bigger priorities that we say we put a lot of money in old age on a societal level and much less on maternal health. I think that's something you could debate, but not, medical outcomes here and that. That's what I think should be debated. And I think there is actually an interesting, I say that again, a bipartisan opportunity if we play that well to get traction. And then one day Anna will have to revise that nothing much has happened, because that is true at the moment, very much so. And the other interesting thing is the US, in a way, knows it won't work economically, because the US is known for poor access to childcare, or very costly access to childcare, for poor maternity laws, and yet for many years it had a better fertility rate than many countries that had, tried to do something on this front. So we know that there is not a very close relationship, and it will never come, because there's so many other societal factors.
Yeah, it's such an interesting point, and it kind of begs the question of what's changing, and I think we're getting at a lot of that in this conversation. And I loved your framing, Henning, strong evidence that there's a weak effect, if I'm getting that right. I think that's a really interesting way of putting it, as well as calling out some of the nuances of maybe, if I understand you correctly, throwing some money at this problem won't work, but we don't know. Maybe a lot of money would have a different effect. You're the experts here, so you'll have to provide a perspective on that. But just in the interest of time, I'm going to move on to the next question, which is, after the Supreme Court's Dobbs decision, which eliminated the constitutional right to abortion, more than a dozen states have issued abortion bans or severely restricted abortion access. And I'd like to talk a little bit about how the abortion restrictions will impact birth rates. Maggie, would you like to start?
Sure. I think, unfortunately, the early evidence is that the abortion bans are sort of, have increased sort of the rates of live births by a small amount. Those are sort of people who might have chosen not to have a child, but didn't get to make that choice. I think there is also some evidence, however, that it's not obvious to me this is very tiny, and I think it's not likely to have a big impact on the overall fertility rate, because there's also a very big impact on the quality of care that people get during pregnancy with restrictive abortion laws in place. So there's sort of corresponding evidence of increases in infant mortality, which are likely related to sort of a combination of social and medical factors that that are both how this causally impacts the kind of care that people get during pregnancy, and the conditions under which families are being made. So I think the sort of I think this will have a substantial impact on the sort of marginal family who ends up having a child, but I don't think we'll see much change in the overall birth rate.
Thanks, Maggie. And I'm interested to get your perspective on this as well, from a health disparities perspective.
Yes, thank you. Well, as Maggie mentioned, there has been, a marginal increase, excuse me, in some states with very strict new abortion laws. In particular, a study in Texas showed that the birth rate the year after Dobbs was instituted increased by 2.3%. Most of that increase happened among Hispanic women between 20 to 24 years of age, women without a college degree, and women living far from healthcare facilities. So we see right away that Dobbs will increase the disparities and inequities, as you mentioned, Veronica. Another way in which Dobbs does that is that it has had a freezing effect on doctors and other healthcare providers that are now afraid of providing care to women, pregnant women who are very, very sick, but whose life may not be at risk. So they wait until the last minute to make sure that they can demonstrate that they terminated the pregnancy because it was the only way to save the woman's life. But sometimes it doesn't work, and women die, and babies with conditions that are not compatible with life are born and then die soon after. So, and that happens mostly to women who don't have the resources to go maybe to a neighboring state where they would be able to terminate the pregnancy early on when they know it's gonna be risky for the woman's life or for the baby's, or incompatible with the baby's life. So women with the resources to maybe order abortion pills online or go to another state won't bear the consequences of the strict abortion laws, while the poorer women or women with lower levels of education or less resources in general are the ones who will bear the consequences of Dobbs. So the short answer is yes, Dobbs is increasing inequalities.
Mm. Thank you, Anna. I know we don't have a lot of time, and Henning, I'd love to get your thoughts on this as well. But while I have you, Anna, I'm curious to get your perspective on the maternal mortality rate in the U.S., which, as we know, is more than 3 times the rate of most other high-income countries, and that the risk of pregnancy-related deaths for Black birthing people is 3 to 4 times higher than those of white people, while we also see that stillbirth rates remain stagnant and face significant inequities as well. So can you share a little bit, we're running a little bit behind time, but maybe really quickly, how we can improve access to maternal and infant health care?
Yes, well, sure. Very quickly, there are entire areas of the country based on a study conducted by the March of Times, 40% of the population live in those areas, that are called maternal health deserts, which means that there are no facilities or there are no trained providers nearby to take care of a pregnancy and a delivery. So one quick way to, and obviously women without access to care, and particularly to quality care, will face major risks for themselves and the baby. So they are the ones who have the higher mortality rates. So one quick thing that could be done would be to reopen. In many cases, those clinics have closed to a number of circumstances. Reopen those clinics, increase other ways to provide healthcare like telemedicine, provide incentives to providers to go to those areas instead of staying in the cities, helping more people interested in healthcare to train and then establish their practices in those areas. But other things need to be done in areas that have plenty of facilities and providers, but still get very poor quality of care, both technical quality and interpersonal quality, or what some people call respectful care. So people have bad experiences, and those people are mostly Black women, as you mentioned before, but other people do too. Although the particular brunt of the situation falls on poor people and people with lower levels of education. So to establish mechanisms to make sure that the quality of care is good and is offered to everyone, is equitable, would definitely be one way to reduce maternal health. The point that so many people are uninsured is another big issue. So the universal health care plan that should be in place instead of what Medicaid tries to do would be another way to improve maternal health. Again, it's something very complex, but it should be possible. It's quite unacceptable that the maternal mortality rates are so high in the United States.
Absolutely. I couldn't agree more. You know, Henning, I noticed a slight reaction on your face when we were talking about Dobbs. Would you like to comment? Do you have anything you'd like to add?
Yeah, thank you. That's well observed, Veronica. I'll make it short. I just wanted to point out, and I think Maggie made the point already, that the Dobbs has quite clear and say important implications on obstetric services and women's rights, you could argue, but I would challenge that it has a big effect on fertility rate. Maggie said it has a small effect in some studies. You can see the confidence intervals, or the uncertainty around those estimates, is quite substantial. And we know that abortion rates have been falling faster than the birth rates. Given that, if you piece that together, I think it is another topic. So I would say the fertility, that further, cutting the rights to abortion will not be the way forward to increase fertility. That's the other message I would put out there. Don't you think that's going to be the way forward? I think these are two different issues, important issues by its own right, but I don't think abortion access is much. And there's many reasons. I don't want to go into that further, but the stats tell us it's a very tiny proportion.
Mm.
Sorry,
lot
may I
behind
say
this.
something very quickly?
Of course.
I don't think that any country that is trying to incentivize their birth rates has imposed restrictions to access to abortion as a policy to achieve that goal. It's not a policy that will work, as Henning was saying.
Yeah, I think that's a really important point. And I think we could probably spend a lot of time on this topic, but I do want to make sure I get Maggie's perspective on the topic of maternal mortality rates, and in particular, any thoughts you have on access to postpartum care or mental health services.
Yeah, I would just say that one sort of really important thing that the data tells us, sort of when we look at, one important way we know what's happening in terms of maternal mortality is the maternal mortality review boards, which are one of the things that are slated for elimination in some of the recent budget bills, right? So one of the reasons we know anything about sort of maternal mortality is that sort of data collection. So I think it's, just to sort of say that we benefit so much from maternal mortality review boards, from the PRAMS data set, which is a sort of survey to pregnant women in the US that every state does, and is an incredible public health resource. So I think that that is sort of one ongoing challenge, is how we know what we know. But one of the things we've learned from those maternal mortality review boards is that almost half of deaths, pregnancy-related deaths, as we define them, happen in the sort of the extended postpartum period. So, and I think a large number of those are not what you would think, right? So it tends to be maternal mental health or suicide or substance related. And so there's, I think there's a constellation of social challenges that get really exacerbated during pregnancy that, that really need to be addressed in a holistic way. And I think one of the things that our health system is just unbelievably bad at is the sort of segmented, fragmented way of doing care. So you might have, this is also related to the second, highest cause of postpartum maternal mortality is cardiovascular related. So, in order to address postpartum mental health, in order to connect people after their pregnancy to primary care, which is where you would address cardiovascular risk factors in an ongoing way, the way that our system currently works is there's an enormous amount of attention paid to people while they're pregnant, visits every week, every other week, towards the end, sometimes every day. And then, my colleague Jessica Cohen sort of coined this term, the postpartum cliff. So after you have your baby, the health system kind of drops you. And I think there's a number, so it drops you, but also what is required for you to really connect to high quality care, where your services might be very complex. You might need a primary care provider to support on improving cardiovascular health. You might need to sort of separately find and interact with a mental health care provider or someone who can support around substance related challenges. The system doesn't do a very good job, or there's really no one who is tasked with helping people figure out what they need and connect them to those services. So I think we have a long way to go to make the postpartum period make sense for people's needs.
Absolutely. It is, I think it's a great topic of the disconnected care and how that plays a role in sort of the foundation of how people view this phase in their life. And I think, if we look at it, how postpartum families are treated compared to, for example, special needs populations where care is truly coordinated, at least on the Medicare, Medicaid side, there's certainly a stark difference. We only have a few minutes left in this, so I want to make sure we get to the topic of parental leave. As we know, the United States has no federal policy for parental leave. One of the things that came out strongly in the polls was sort of this desire for the government to step in this aspect, or the amount of paid time off, which is largely dependent on the employer. So I'm curious, Henning, having a sort of global perspective, as well as the others, what lessons can the U.S. learn from countries with guaranteed parental leave? And is there evidence that parental leave improves birth rates?
I would say, to use Maggie's and my terminology, the evidence is very weak here. So there is some Swedish data from a while ago, but that's been changed again after the fertility rate declined again, that offering generous leave and even sort of pushing men to take leave too, and making that the rule can improve fertility rates a bit. But I just checked the data and the recent evidence, and it's sort of not very strong at all. So, and again, I would like to point out when I say this, that people who think about this, that any measure we take will have a modest effect, only because there's so many things contributing to this. So I think to say we are waiting and looking for the measure that has a big effect is an illusion. There are no big effects in this discussion. I could think of how social media is used to, I don't know, I could think jobs and economic things and partner relationships and religious communities and everything, you could push and pull everywhere. Everything will have a small effect. So this has a small effect. I would like to point out, without making that a big story, to keep my answer short, it has a bigger effect on child care quality and health. So again, there is another reason to argue for this. It has also a reason on parental quality of life, parental well-being. And these are very important goals. Without going into details why they are so important, why they are poor at the moment, why parents are struggling with mental health problems, I'd like to point that out. So I'm a big fan of this. And it should also be paid by the government, by the employer, and actually also by people themselves can contribute that with a lifetime savings model. I think we can do better here.
That's fascinating. And we only have, I love, by the way, before I go on to another topic, this idea that there's maybe many small effects. Again, going back to the notion shared earlier that there's no sort of simple answer. It's a nuanced answer, if one that we should be searching for at all. Before we close, I'd like to just take an audience question that really intrigues me. The question is, what is the most surprising information or solutions you found in research as to why the birth rate is declining? This is particularly fascinating because I've been seeing some unexpected developments on multiple fronts. And like we've said, it's less about economics, while at the same time, there's a lot of interesting tech innovations that are coming out that are saying that they're going to change the game entirely. So precision nutrition AI for managing infertility, new fetal well-being technologies to address stillbirth, wearable devices with ovulation predictions. So I'm curious for you, the panelists, and you tell me who'd like to start. What's the most surprising thing that you've discovered about why birth rates are declining and any solutions that you've seen?
Well, I can start but my comment will be a little disappointing, I think. I don't find anything surprising in the decline of birth rates. I mean, the many factors that we mentioned today explain, each of them maybe at a small scale, but all together explain why fertility rates are declining. And as Henning was saying, I don't think there's gonna be a magic bullet or one or a couple of innovations that will change this because, well, it's so complex. So I think that we need to be patient, continue studying what's behind the declining rates and think of, I would think more about people's health and rights than about demographic goals.
Absolutely. Henning, did you want to add something?
I would like to add my 2 cents worth or my 2 points on surprising facts. I'll give you them. The first surprising fact when you look into the data is that you see all these fertility declines, but the other fact is that many, many women, when they reach 40, 45, have not reached their fertility goal. And that mismatch has struck me as something, how can we not as a society reconcile that? So that's what I'm saying. We feel that we, as a society now, or as families, or in what instance, as potential grandfathers, that we don't have children. And then we see that women don't meet these fertility goals. So many women have missed the chance, or have not been fertile, or have started late, or had no partner, had no partner, I can give things, or had no support. That's one thing that's really surprising. The second thing is how poor the research is. And it's really just shocking if you look at the data. If I wanted, I can give you 10 examples of where I look for data and I can't find it. We don't even have a life course study of women to see what, when and how they want children. We also make it a black and white, and we never have studies that say, I'm thinking about it or I'm not, and on a sort of continuous level, both over time and the wish. We lack data like this totally. So we have not assessed it. We've not put money in these kind of questions. Why don't they have data? Because that changes. It's not that women say when they're 22, they might say it's because of global warming, I don't want children. It was 25. It's because they have not finished their education. It was 28 that they have no partner. And all that is on a relative scale. We lack that data completely from a sociological and even economic perspective. So those are the 2 things I would like to point out.
Those are both excellent points. Maggie, anything you want to add to this question, or any other last points?
No, but I would very much like to see Henning's imaginary study funded, because I think that people think of fertility intentions as this fixed thing, right? We think each woman has one number in mind, when we think about how many children she wants to have. And I think in reality, that is not the case at all. I think the decision about how and when to have children is incredibly complex, and it changes dynamically over the course of your life. And, I think the only last thing I would say is that I think for many women, they would like to have more children than they are able to have. And so I think there's a real public health value in thinking more about better understanding of fertility, the factors that affect fertility, making fertility options available to more different kinds of people, because right now the access to them is quite inequitable. And as Henning said, I think understanding why, what it is about our society that makes people, hesitant or reticent about having children would actually be quite important, not just for the declining birth rate, but for making a society where people sort of thrive and, you can kind of live in sort of, a more joyful and connected and community-oriented way.
Yeah, those are really insightful comments. I mean, it kind of hints at the fact that maybe we don't know of any strong sort of easy fixes now, but it may also be because we don't have the data to know.
Yeah.
So, with that, I'd like to thank the panelists for this thoughtful conversation, which, if I had it my way, we could have a lot longer. If you in the audience have missed any part of the program, you'll be able to view it on demand on the Harvard Chan School's YouTube channel. And I hope that you have a wonderful afternoon.
Thank you.
Thank you,
everyone.
Thank you, everyone.